This week, we've been taking an in-depth look at the human papilloma virus, or HPV, a common virus found in a lot of us. Well, we're well aware that this can cause cervical cancer in women, but now it has become a leading cause of head and neck cancers in middle-aged men. Once you're exposed to the virus, you're exposed, and there's no telling what it'll do. Well, in part 3 of our special health report, we turn our focus to our kids and what you can do to now help prevent your daughters and sons from ever getting it.
They smell wonderful. Oh, wow, that's amazing.
Steve Sicoscio slows down to enjoy life's little things as he heals from HPV mouth cancer. He says his hope is that young men will never know his pain.
It has been a bad dream because the surgery that I underwent and then the treatments for it were just so devastating, and nothing that you could ever really imagine going through.
There is a federally approved vaccine for both young girls and boys to prevent HPV infection. It's given to tweens and teens in a series of 2 to 3 shots before they become sexually active. Pediatrician Mark Osborne wants this mandatory.
It's basically the only vaccine we have that prevents cancer.
Dr. Osborne says most parents are vaccinating their girls, but not their boys. He wants federal health officials to do more to educate parents.
There's so much more information out now that shows us not only does it protect the girls by protecting the boys as carriers, but we're preventing primary disease in the boys as well.
Is it a different vaccine?
Same vaccine, same effectiveness, same cancer prevention statistics.
There's more outreach than ever.
Maybe if they had known there was a vaccine to help protect me when I was 11 or 12.
This effort is to get more parents to vaccinate their girls and their boys.
If we can prevent cancer down the road 30 or 40 years for these patients, that's such a big plus.
I am back with some of the bands and I'm singing again, which is great.
And when it comes to the stigma surrounding sexually transmitted disease, HPV, and cancer, he encourages men not to wait and go to the doctor.
You should never be embarrassed of it. This is your life. If you're going to compare the two, your life versus embarrassment, that's kind of crazy to me. Never give up. Just stay positive and keep pushing forward.
Well, Dr. Duncan is advising parents to talk with their pediatricians about the pros and cons of the HPV vaccine for both their daughters and their sons. And again, our patient Steve there was shocked by his diagnosis, but he quickly realized he was far from alone in this fight. Doctors say we need to candidly talk about health issues that can be uncomfortable because you're not alone, and it can be a matter of life and death.